We initially presented the interim analysis of the randomized phase 3 TRANSFORM trial a year ago. The TRANSFORM trial is evaluating Lisocabtagene maraleucel compared with standard of care as second-line therapy in patients with relapsed or refractory large B-cell lymphomas. At the time of the interim analysis, with a median follow-up of just 6 months, we did confirm our primary endpoint with superior event-free survival over standard of care. But of course, that was an interim analysis. And our primary analysis, which is event-driven, has now been triggered at a median follow-up of 17.5 months. And sure enough, we continue to support our findings of liso-cel as superior therapy in second line over the historic standard of care of platinum-based chemotherapy, followed by beam and autologous stem cell transplant for chemotherapy-sensitive patients. And the difference is clearly quite remarkable. Our primary endpoint was event-free survival. The median event-free survival for liso-cel was not reached, compared to only 2 months for the standard of care. And that amounts to an 18-month event-free survival rate of 53% with liso-cel compared to only 21% for standard of care. We also saw superiority in all of our secondary efficacy endpoints, including progression-free survival, complete response rate, as well as a trend towards overall survival benefit, which was not statistically significant, likely owing to the protocol built-in crossover which was allowed. And in fact, on the standard of care arm, 2/3 of patients failed standard therapy and crossed over to liso-cel. So we conducted a supportive overall survival analysis to adjust for the impact of crossover, and in fact found a superior overall survival benefit favoring liso-cel over standard of care when adjusting for the impact of crossover. We also, of course, looked at toxicity. We found that toxicity was extremely manageable and actually quite favorable overall relative to other CAR T-cell products. Overall, the incidence of cytokine release syndrome on liso-cel was 49%, but was severe in 1%. There was a single case of grade 3 CRS, and there was no grade 4 or 5 CRS events. Neurotoxicity was similarly low. We only saw 11% of patients develop neurotoxicity. There were 4 cases of grade 3 neurotoxicity and no grade 4 or 5 events. So we really find with mature follow-up at 18 months that liso-cel we think is a preferred second-line therapy for patients with primary refractory disease or large B-cell lymphoma relapsing within 1 year of initial therapy.